Very good evening, everyone. And this is a very important topic we have chosen by our uh, eminent speakers, that is rheumatoid arthritis. As you all know, rheumatoid arthritis is an autoimmune disease. It is a chronic inflammatory disorder that can affect more than not the joint. It affects your skin, it affects your eyes, lungs, heart, blood vessels, and it damages gradually. So we called it as a silent killer. Just a second. Someone has unmuted. Showdhury has unmuted. So, rheumatoid arthritis is not just a autoimmune disease. It actually, rheumatoid arthritis occurs the immune system mistakenly attacks your own blood tissues. For example, you have kept a security guard at your home, and if the security guard, instead of protecting you, attacks you, so what happened? So just arthritis is doing the same thing, that your own immune system is attacking you. So there are many things, and it is bit different from the osteoarthritis, though like osteoarthritis, it is having joint pain, swelling, everything is there. So diet plays a very important role along with the lifestyle management. So inflammation associated with rheumatoid arthritis need to be treated with medications, and there are sometimes, if required, steroids are also given. We will discuss the medicines also, which are the medicine and what are the side effects for long term. Even the nutrition supplements and the functional food is very important in rheumatoid arthritis. So you will just get to know about this rheumatoid arthritis from our eminent speakers. So, moving to the introduction of the speakers. So, our first speaker is Pritha Bose. Pritha Bose is also our member of Cognized Nutrition. She has completed BSc in Food and Nutrition from University of Calcutta, MSc in Applied Nutrition from West Bengal University of Health Science, completed the 6-month diabetes educator from NDP. She is certificate community nutritionist in Sahayata Foundation, which is an NGO. She is also working in Ramakrishna Mission Seva Pratishthan, and also she is our student as well as our member. Rajashree Ghosal is food in nutrition in the University of Calcutta, masters in food and nutrition from Ramakrishna Mission, Vivekananda Mission, Sharada Girls College, completed internship from IQ City Hospital, Durgapur, and she is the batch 4 medical nutrition student of Cognized Nutrition. Priyanka Chowdhury is BSc from Calcutta, MSc in dietetics and community nutrition management, completed 4 months dietitian internship from ILS Hospital, and students of medical nutrition therapy and member of Cognized Nutrition as well. Ritu is our very old student. Ritu is graduate from University of Calcutta in Nutrition Honors, Master in Food and Nutrition from West Bengal State University, completed clinical internship 6 months from Park Clinic, again completed internship from Ramakrishna Mission. She has also worked in Shahata Foundation. She was a trainee dietitian in CMC Vellore, and she has experienced many things. Even Ritu used to share with me the days when she was working in Christian Medical College, Vellore. She is also diabetes educator from National Diabetes Educator Project, Dr. Mohans, and she is medical nutrition therapy completed from Cognized Nutrition. So these are all 4 speakers of us. So next we will share the introduction. The content is introduction of the rheumatoid arthritis. We will discuss incidence and prevalence, associated risk factor, stages of rheumatoid arthritis, clinical manifestation, how you will diagnosis, what are the tests you will find that the patient is experiencing rheumatoid arthritis, association of rheumatoid arthritis and comorbidities, medical and surgical management, medical nutrition therapy, role of functional food, already I told, dietary modification, role of fatty acids and omega-3 fats, foods to be avoided, take-home message, and obviously the reference from where they have taken. So welcome, Pritha, to start today's session. I am also very much excited to learn many things from today's session.
Thank you, sir, for this lovely introduction and giving a brief idea of the disease. Good evening, everyone. I would like to say, what do you mean by the term autoimmunity? We all know that our healthy immune system functions. How? By protecting our body against viruses and infections and also the disease. But what happens if our own immune system destroys its own cells by itself? Yes, this condition is known as autoimmunity, and and it is also termed as autoimmune diseases. If we take a glance on the picture, we can see the organs that are involved with the immune system. What are they? They are the tonsils, the thymus, the spleen, lymph nodes, and bone marrow. As a result, if our immune system gets impaired, it attacks any parts of the body. As a result, it weakens the body functions and can even turn deadly. How it happens? It happens from a combination of various types of factors, be it genetics, be it the impairment of the white blood cells, be it a lifestyle disorder, hormonal imbalance, as well as environmental factors. And the combination of these factors leads to the triggering of the disease. Now, coming to this slide, it explains the prevalence rate of some of the very common autoimmune diseases that are known to us. And if we take a look at the third row, where the rheumatoid arthritis is seen, it can be well explained that, it can be well cited that the prevalence rate is very high. It is 552 among 1 lakh person, which is obviously quite high, and is followed by other autoimmune diseases, as we all know, type 1 diabetes, multiple sclerosis, ulcerative colitis, celiac disease, etc. And the next part in the bar diagram, it is well established that the prevalence rate of men and women, and it is seen the prevalence of women is more higher than men in most of these cases. Now we come to the main topic, that is the rheumatoid arthritis. The word rheumatoid comes from the word rheumatism. What does it mean? It means musculoskeletal illness. And arthritis is derived from two words, arth and ritis, where arth means joint and ritis means inflammation. So what can we say? That rheumatoid arthritis is a chronic inflammatory joint disease where our immune system identifies the synovial membrane, which is present in the joints, as a foreign body and attacks it, resulting in the condition known as inflammatory synovitis. If we look at the picture, we can see three things. The picture depicts the thickening of the synovial membrane with the gradual loss of synovial fluid, and the cartilage gets gradually degraded. As a result, we all know inflammation occurs that leads to the damage of the joint tissue. And this damage can cause long-lasting chronic pain, unsteadiness, lack of balance, and deformity. This is a study based in the USA population, and it is seen that 860% among 1 lakh people are prone to rheumatoid arthritis. It is also seen in the study that the females are more prone to the disease. They are actually 3 times higher in risk of acquiring this disease. Also, if we take a look in the graph, we can see the onset of the disease can occur at any age groups, be it 90 up to 80. But the peak strikes between the age 40 to 59 years. Also, it is seen mostly the females are prone to the disease, at 75% of the women are affected. This slide explains the risk factors which are probably associated with the disease. They are classified broadly into 2 terms: environmental factors, and host factors. And the interaction of these two factors lead to the triggering of the disease. The environmental factors include smoking, airborne agents which is present in the environment like silica dust, air pollution obviously, the infectious agents like pathogens, our lifestyle disorders like lack of physical activity or indulging in a bad lifestyle, socioeconomic status, diet, and microbiota. Whereas on the other hand, if we see on the host factors, we can see that respiratory and allergy diseases like asthma, COPD, immune-mediated diseases like type 1 diabetes, IBD, genetic disorders like the impairment or the problem in the gene, the defect in the gene, HLA, that is human leukocyte antigen DRB1. And as we know, it is the factor which affects it is a genetic factor, the heredity factor. So any defects in this HLA DRB1 gene can also lead to the disease. Also, other examples include neurological and psychiatric disorders like sleep disorders, depression, neuroendocrine and hormonal imbalance, also including epigenetics. Now, it is a very important slide where the rheumatoid arthritis stages are depicted. But before moving on to the stages, as we see that the disease is a progressive one, we have to know what a healthy joint without the disease or free from the disease looks like. A healthy joint has an articular cartilage. What is it? An articular cartilage is a connective tissue that acts as a protective cushion, preventing the rough friction. Talking about the knee joint, where the picture depicts, it is a knee joint or the synovial joint, we can see that the synovial joint connects the two bones, as we can see in the picture, with a fibrous joint capsule. The fibrous capsule is lined by the synovial membrane, and inside this synovial membrane, there is the synovial fluid. And what is the function of it? The synovial fluid prevents the rough friction between the two bones and also decrease the erosion. But with the onset of the disease in the early stages, what happens? The synovial membrane gets inflamed and thickened. As a result, the bones and cartilage is gradually eroded. This condition is known as synovitis. The next stage is known as the pannus formation, where if there is extensive cartilage loss, the bones of the cartilage is exposed, leading to pitted bones. The third stage is known as fibrous ankylosis, where the joints get invaded by fibrous connective tissue. Here, the joints becomes bent gradually and deformed. And what happens? The nerves which are present nearby, they get pressed or tapered, causing irresistible pain. In the third stage is known as bony ankylosis, and in this stage, the joints become destroyed totally with the loss of the synovial fluid. The two bones gets fused together. And one more thing, if this disease is not treatable from the early stage, it becomes irreversible. If we progress to the fourth stage, there is a lower stage. Okay. This slide explains what are the clinical manifestations of rheumatoid arthritis. As we can say that it is a disease that can affect not only our joint, but also different parts of our body, be it the eyes, resulting in dry eyes, redness, ulceration, or the mouth, that is reducing the saliva production, making it dry. The skin gets rashes. Our heart muscles get destroyed, and it occurs pericarditis, that is inflammation of the heart lining, leading to heart disease. Our digestive system get impaired, leading to various diseases like IBD, ulcers, etc. Our bones get brittled and breakable. Also, it affects the upper and the lower extremities where there is swelling occurs. The peripheral neuropathy occurs that results in pain sensation, the pins and needle-like sensations, and numbness and weakness. Also, it affects the blood vessels because, as we know, the nerves get tapered. So, there will be narrowing of the arteries, leading to pain sensation, blood clots, anemia, and obviously, if untreatable, can also lead to death. Now, these are some of the specific symptoms that are quite experienced by a patient of rheumatoid arthritis. What are they? Stiffness, swelling, joint pain, tinglings and numbness sensation, joint deformity, loss of function, unsteadiness, morning stiffness, weight loss, fatigue, low-grade fever, as well as anemia due to folic acid deficiency. Now, for till then, so far we have learned about the various manifestations or symptoms or the risk factors of the rheumatoid arthritis disease. But how to diagnose the disease? The diagnosis is quite difficult in the early stage because we have already learned the disease is a progressive one. It develops over time and only a few symptoms is present in the early stage. People may say that पाय ব্যথা করছে, पैरों में दर्द है, हम चल नहीं सकते, पर ये ऐसे नहीं कर सकते कि rheumatoid arthritis ही हुआ है. So there is no a single test for the disease. The symptoms differ from person to person. So what can be done as a diagnosis criteria? The first diagnosis criteria involves the taking of the medical history of the patient, like the onset of the symptoms. कहाँ हुआ, कब हुआ, कैसे हुआ, ये सब. Limitation of the activities, like if the patient is experiencing any difficulty in walking or any movement, bodily movement. Also, the associated medical problems and the medications if the patient is taking. The next criteria involves physical examination, where our bones get examined. We have to look onto the posture of the working, any signs of inflammation or rashes on the skin or any other parts of the body. The last or the very important part is the laboratory test or the blood test. What can be done? The first one involves rheumatoid factor test. This blood test checks for rheumatoid factor. It is an antibody that many people with rheumatoid arthritis can eventually have in their blood. And as I've already said, it is an autoimmune disease. Means what? Our body identifies its own cells as a foreign one and starts invading them. So the RF factor will be present, obviously positive. Next is the complete blood count, that is a CBC, where WBC count, hemoglobin, and other neutrophils and other platelets are counted, are detected. The next one is the erythrocyte sedimentation rate or the ESR rate. That test, this test measures the inflammation in the body and monitors disease activity and response to treatment. And the last but not the least, the very important part is the C-reactive protein. As we have already said, is an inflammatory disease. So the inflammatory markers will be always present in the blood. And CRP value, what does it do? It detects the rate of infection in the body. So this is another very common test for inflammation that can help diagnose the rheumatoid arthritis disease and monitor the disease activity and response to treatments. The normal level is less than 3.0 mg per liter. That is, it should be below 3. But what happens? It is quite high in rheumatoid arthritis patients. And one more thing to say, that if a patient develops rheumatoid arthritis in the early stages, he have to acquire the disease with the lifetime. This slide explains the various comorbidities that we obviously seen with a patient with rheumatoid arthritis. But why? Why it is so? As we know that infection is occurred in this disease, and infection can lead to the production of inflammatory markers. And what are they? That is the cytokines, chemokines, complement factors. If we specifically talk about the adipocytes, what are the adipocytes? They are the fat cells that primarily compose the adipose tissue, and they are the main energy concentration of our body. What happens when these adipocytes gets inflamed? They lead to the release of adipokines, namely adiponectin, leptin, bisphatin, and resistin. This adipokines is the main cause of this comorbidities. ये जड़ है सब disease का. What does it do? It creates insulin sensitivity. That is the uncontrolled blood sugar level, leading to obviously diabetes. Next, cardiovascular diseases. As we have seen that the pericarditis, the pericardial membrane gets affected, inflamed. It leads to cardiovascular diseases, also atherosclerosis, the nerve endings get tapered, leading to high blood pressure, arthritis, of course, and obesity. So that's all. And one more thing, the cardiovascular diseases, if we talk about, it is seen that rheumatoid arthritis increases 60% the risk of heart attack and stroke within 1 year of its onset. So the next part will be explained by my co-member Rajashree Ghosal, which is the medical management and surgical management part. Thank you for bearing with me, and over to you, Rajashree. Thank you.
So thank you, Pritha, for describing your part so nicely and introducing me as well. So very good evening to all. I am Rajashree Ghoshal, as previously sir introduced me, and I am going to explain the medical management of rheumatoid arthritis. Rheumatoid arthritis is managed with medication and self-management strategy. Self-management strategy means physiotherapy. What we can do by the treatment, we can slow down the disease and prevent joint deformity. It is not totally curative. It is to slow down the disease so that we can maintain the quality of life. Okay. Aim of treatment. According to ACR, American College of Rheumatology, or EULAR, European League Against Rheumatism, aim of treatment is to slow down the disease so that only tender joint count is less than equal to 1. Means one joint involved is permeable, means permitted. Tender joint, like old aged person, they they always complain যে আমার পায়ে ব্যথা করছে, they always complain their legs are paining. You can allow one joint pain. Up to that level, it is treatable. Swollen joint count is less than equal to 1, means less than 1 or maximum 1. And C-reactive protein is less than 1 mg per dl. C-reactive protein is a prognostic indicator or inflammatory marker of the disease. Means arthritis. Itis means inflammation. Any kind of itis is inflammation, like peritonitis, inflammation occurs in stomach. Uveitis in eye. Conjunctivitis means in eye. So when CRP is increasing, the disease is deteriorating, and when CRP is decreasing, the disease is improving. Principles of management is physical rest, means give a relief to the joint, not bed rest, to prevent the joint deformity, and targeted anti-inflammatory therapy with passive exercise. We know that there are two types of exercise. One is active exercise and another is passive exercise. Active exercise is like running, swimming, etc. And passive exercise is like bending the leg by keeping it over a pillow, or means stretching. Approach should be done by doctors, nurse, physiotherapists, occupational therapists. Occupational therapists means who are specialized in occupational therapy to promote a person's ability to fulfill their daily routine and role. For example, traffic police. Traffic police having rheumatoid arthritis is not a correct occupation. So he or she has to go to occupation therapy for identifying her correct occupation. And patient education and counseling is must. Second slide, please. For improving quality of life, there are two kinds of management. One is medical management and another is surgical management. Next slide, please. Medical management. Medical management is aggressive therapy for younger patients and less aggressive therapy for old-aged patients. Milder disease is treated with non-steroidal anti-inflammatory drugs like brufen, aceclofenac, ibuprofen, paracetamol. Side effects of these medicines is gastritis, impairment of renal function. and paracetamol has less side effects. Fourth slide, please. Treatment in case of mainstay. Disease modifying anti-inflammatory drug, DMARD. Main drug is disease modifying anti-rheumatoid drug. So in case of milder disease, painkiller is only suitable. But disease modifying drugs, there are two types of DMRD. One is synthetic DMRD and another is biologic DMRD. In case of synthetic DMRD, main drug is methotrexate. Its initial dose is 7.5 mg. After 1 week, doctor switch over to minimum dose, that is 15 mg orally once per week. Still, if it is not recovering, then maximum dose is 20 to 25 mg. But methotrexate is anti-cancer drug. In case of anti-cancer, methotrexate is used in high amount or high dose, but here it is used in low dose. There is also side effect of this drug like cytopenia, hepatotoxicity. Cytopenia means blood count কমে যাওয়া, mainly leukocyte count. Hepatotoxicity means liver injury. WBC count decreasing, gastric irritation. Stomatitis means oral ulcer. Methotrexate usually given with folic acid, but why? This will be explained by my next co-member in another slide. Glucocorticoid may be used. It is used in low to moderate dose, usually orally, but it can be used by intra-articular injections. মানে জয়েন্টের মধ্যে ইনজেকশন দিয়ে দেওয়া যেটাকে বলে, that is intra-articular injection. Glucocorticoid is a steroid hormone. Its side effect is osteoporosis, means হাড়গুলো গুঁড়ো গুঁড়ো হয়ে যাওয়া, or weakening of bone and prone to infection. So what are the main drugs? One is methotrexate and another one is glucocorticoid. Other DMRDs are sulfasalazine, leflunomide, antimalarials like chloroquine. Long-term use of chloroquine may cause problems with retina. Minocycline, tofacitinib. Anti-TNF agent. TNF agent means tumor necrotic factor. Who are the anti-TNF? Infliximab and etanercept. Anakinra. Rituximab usually used mostly. Interleukin-6 inhibitor used in COVID cases. These are biologic DMRDs. Traditional DMRDs target the entire immune system, whereas biologics work for targeting specific steps in inflammatory process. And JAK inhibitors block the action in our body to help prevent the inflammation. Next slide, please. Surgical management. What can we do through surgical management? Surgical procedures may improve the pain and disability in rheumatoid arthritis with varying degrees. When medical management cannot control the disease, at that point, surgical management is also needed, but medical management is must. In small joints like metatarpopharyngeal, tarpo means in hand and tarpo means leg. Arthroplasty is needed. Arthroplasty means plastic surgery. একটু অদল বদল করে দিল, জয়েন্টটাকে স্ট্রেনথেন করে দিল, যে জয়েন্টগুলো খারাপ হয়ে গেছে সেগুলোকে কেটে বাদ দিয়ে দেওয়া. This means our arthroplasty. In large joint means shoulder, hip, knee. Arthrodesis is a surgical procedure that uses the bones in a joint so that they don't move. In simpler terms, orthosurgeon manually straightens out the damaged joint and removes the cartilage and then stabilizes the bones so that they heal too. And total hip replacement and knee replacement is there. Arthrodesis and total wrist arthroplasty reserved for severe disease. For hallux valgus in forefoot needed. Arthrodesis for refractory pains means the pain গুলো কোনোদিনও resolve হয় না. Sometimes osteoarthritis associated with rheumatoid arthritis, and it is seen in elderly patients above 60. So the later portion of the slide a mentee slide will be discussed by Sudhir. So, see, it is over to you now.
Thank you, Rajashree, for handing me and describing your part so nicely. So, good evening, everyone. I'm Ritu Bhattacharya. Now, I'm going to discuss about the medical nutritional therapy of rheumatoid arthritis. Now, coming to the medical nutritional therapy part, there is a four way to manage rheumatoid arthritis. The number one, the first way is to give a balanced diet with appropriate calories for maintenance of weight of that patient. It has seen that if we reduce the amount of cereals from the patient daily lifestyle routine, from their patient, daily routine of the diet, then we can easily manage their weight. And if we are able to manage their weight, then we can also manage the symptoms of rheumatoid arthritis, because the excessive weight puts a burden on weight bearing joints like knees or some other joints of our bodies. The second way is to give anti-inflammatory diet to that patient. We all know that in previous slide, Pritha at first introduced, spoken about it, that it is an autoimmune disease. When it is an autoimmune disease, it is an autoimmune inflammatory joint disease where our own immune system identifies the synovial membrane as a foreign particle and attacks it, resulting in inflammatory synovitis.
খাবারটা হয়ে গেছে বাকিগুলো চলছে।
You can continue. You can continue.
In this case, if we give that patient anti-inflammatory diet, then it will be helpful for that patient, because anti-inflammatory diet will reduce the inflammation and helpful for that patient. The third way for the medical nutritional therapy is to give omega-3 fatty acid supplementation. Omega-3 fatty acid has the property of the anti-inflammation, which reduces the inflammatory markers of the body. When the inflammatory markers of the body once reduces, then the physical performance of the body will also automatically increase. Then, so why, if we include the omega rich food like nuts or sea fish or seeds in our daily lifestyle routine, in our daily diet, then it will be very helpful for that patient. And we can also include some anti-inflammatory diet like DASH diet or low histamine diet or low calorie diet. It will be very helpful for that patient who are suffering from rheumatoid arthritis. The fourth way and the last way is to give adequate amount of calcium and vitamin D supplementation. We all know that the vitamin D has the anti-inflammatory action, and it also helps to absorb the calcium in our body, which is essential for the building strong bones. So, by giving adequate vitamin D supplementation and calcium-rich food like milk or milk products, it will be also very helpful for that patient who are suffering from rheumatoid arthritis. Next slide. In this slide, I am going to talk about the functional food. The role of functional food in arthritis. At first, we have to know what is functional food means. What actually the functional food means. Functional foods are ingredients that offer health benefits that extend beyond their nutritive value. And some types of functional foods do contain some supplements or some other additional ingredients which are designed to improve our health. These functional foods also present in some foods, fruits or vegetables or nuts, and these are also known as the nutraceuticals. And in groups, these are known as flavonoids or carotenoids. Now, where we can get these type of flavonoids or carotenoids? Flavonoids, we can get flavonoids from plants. These are able to inhibit both isoforms of inducible nitric oxide synthase and the cyclooxygenase, which are involved in the production of the inflammatory mediators. When the inflammatory mediators are reduced, then the inflammation will also automatically reduce. These flavonoids are present in some foods like berries or green tea or grapes, etc. Now, coming to the carotenoids, we can also found carotenoids in foods or green leafy vegetables. Especially carotenoids, we can find carotenoids in tomato. These are also antioxidants. In tomato, the importance in tomato, there is a special type of compound which is called as lycopene, which is also comes under the group of carotenoid compounds. After cooking, the level of lycopene will also increase, and it has an anti-inflammatory property which reduces the inflammation. And inflammatory markers like CRP, C-reactive protein, and or interleukin 6, etc. Next slide. Now, coming to the foods which we have to include, which we must include in our diet to prevent or to improve the condition of a patient who is suffering from the rheumatoid arthritis. At first, in previous slides, my many of co-members have spoken about the antioxidant and inflammation. So, to prevent inflammation, we have to include the antioxidant which destroys actually the reactive oxygen species in our body. When the reactive oxygen species destroyed, then the rheumatoid arthritis will also improve. The inflammation reduces. So we have to include in our diet some foods which are rich in antioxidant. Those are vitamin E group foods, vitamin C rich foods, vitamin E rich foods, or selenium like minerals. We have to include selenium like minerals which are present in some fruits or leafy vegetables or nuts, green tea, etc. The second and very important food we have to include, is calcium. In previous slide, we also spoken about the vitamin D and calcium supplementation. So we have to include these type of foods because calcium helps in the bone formation, which is known as the osteoblast, and bone prevents the bone resorption, which is known as osteoclast. And if the bone formation increases and bone resorption decreases, then the arthritis can be prevented. So people should also include in their diet the calcium-rich foods like milk and milk products or millets, which is rich in ragi type of millets, which is rich in calcium, some eggs, fish, etc. We must include in our diet the fiber, because in this case, we have to reduce our weight, and we have to maintain that reduced weight. So why we have to include the fiber in our food style, in our lifestyle. Some fiber-rich foods are green leafy vegetables or whole fruits or whole grains, etc. Now, coming to the folic acid, we also have to include folic acid in our diet, because a common drug which is used in prevention of the rheumatoid arthritis, as which is described by the Rajashree, that is methotrexate. And a common side effect by using this drug, a common side effect is methotrexate reduces the folic acid level in our blood. So the patient might have anemia, may suffer from anemia. So why we have to include folic acid rich foods like broccoli, green leafy vegetables, peas, cabbage, etc. Next slide. Now coming to the spices, Indian culture is full of spices. There is a lot of uses of spices we can see, and spices also have a anti-inflammatory property. It reduces inflammation of our body, so we should also include the spices. A common spices which is used in our daily lifestyle routine is turmeric. Turmeric contain a compound which is known as curcumin, which has the anti-inflammatory property, and the black pepper, which also contain the pepperine compound, which also have the anti-inflammatory property. But if we use together in one food item, then both will work very good. The activity of these two spices will increase. So if we use these type of spices in one food, it will be better. Another food spices which we can include is chili pepper, which contain capsaicin type of compound. These capsaicin also helps in the reduction of the inflammation of our body. So it also have the anti-inflammatory property. Next slide. Here I have given some clinical trials of various dietary interventions in rheumatoid arthritis. In these trials, the emphasis has been given on subtotal fasting. Now we have to know what is subtotal fasting means. What is subtotal fasting? Subtotal fasting means the patient were allowed to have limited amount of vitamins and mineral supplementation, carbohydrate and energy in forms of vegetables juice. By these 7 to 10 days fasting diet, the T cell activation also reduced. When the T cell activation reduced, the immunosuppression will occur. And if immunosuppression occurs, then it suppresses the rheumatoid arthritis, which improves the condition. So if we include this type of diet for a patient of rheumatoid arthritis, then it can also be helpful. In these trials, there are two groups. One is diet group, which is contain 27 of patients, and second is control group, which contains 26 patients. And this control group has given ordinary diet, plain diet, which we usually takes in our daily basis. Now this diet group, they are given 7 to 10 days of subtotal fasting. After finishing the 7 to 10 days of subtotal fasting, they are followed by 3.5 months on. They are followed by 3.5 months another type of diet, which is on individually adjusted gluten-free vegan diet. Again, it is followed by lacto-vegetarian diet. So, as a result of these kind of trials, it has seen that the tenderness of the bones, the swollenness of the joint, the pains of the joint, the pains of the body, the morning stiffness duration, which is common symptoms of rheumatoid arthritic patients, the inflammatory markers of our body, which is C-reactive protein, CRP, the WBC count, these symptoms are reduced. So if if we follow this type of diet for 1 year, the condition of these patients will also be improves. So thank you everyone for bearing with me. Now the rest part of the MNT will be discussed by my co-member Priyanka. Over to you, Priyanka.
We came to the last part of our presentation. So few slides left. Priyanka, welcome. Then we will discuss the Q&A session. Few things, drugs, and everything cannot be covered in one day presentation. Priyanka, you are most welcome.
Thank you, sir. Thank you for welcoming me. First of all, I would like to thank all my previous speakers for their excellent presentation. And special thanks to Shomendu sir and Ananya ma'am for guiding me and giving us a platform like Cognize Nutrition. My part for today is the dietary guidelines for rheumatoid arthritis. As Pritha described, that it is an autoimmune inflammatory joint disease. So, our main target should be including foods that have anti-inflammatory effects. So, we need to choose a diet with plenty of whole grain products, fruits, and vegetables. Omega-3 fatty acid foods that is found in flax seeds, fish, etc. Also, spices have anti-inflammatory effect, so we need to include them and dairy products, mushroom, etc. in our diet. The diet should be low in saturated fat and cholesterol. The patient should try to take moderate to low amount of sugars and sugar containing foods. Alcoholic beverages should be avoided. Rarely, in any occasional event, it can be consumed, but better to be avoided as it can interfere with the medication. But not only diet, we also need to balance the food with physical activity, which also help the patient to maintain an ideal weight. Next slide. Here in this slide, you can see how EPA, DHA, and ALA, three omega-3 fatty acids, help in increasing the muscle mass, muscle strength, and muscle activity, that is, walking speed, chair rising, hand grip, etc. These fatty acids also have anti-inflammatory effects. They help in reducing inflammatory cytokine, tumor necrosis factor alpha, and interleukin 6. So we must eat more healthy fats than saturated and trans fats. We must eat whole grains and prevent the refined grains. Berries, fruits, and green veggies should be included in our diet. Next slide. In this slide, we can see the foods that to be avoided in rheumatoid arthritis. Foods that help in inflammation, also called pro-inflammatory foods, like processed carbohydrates, white sugars and sugar-containing foods, saturated and trans fats, red meat and processed meats, gluten-containing foods, and fried and oily foods. Next slide. Here are some quick take-home messages for rheumatoid arthritis patients. They need to quit smoking and avoid the alcohol intake. Eating junk foods should be stopped as they contain high saturated and trans fat. They should follow a healthy and balanced diet prepared by a dietitian. And regularly, it should be checked by the dietitian if there is possibility of any changes. Exercise should be regularly done. Gentle exercise can help to strengthen the muscle around the joints. And it also help reduce fatigue and also help to keep a healthy weight for the patient. Reducing the stress is also very much important and the patient need to rest properly. Taking the proper medication and visiting the doctor is also a very important part. Applying heat to the joints can help to ease the pain and help to relax the painful muscles. Next slide. Now here are the study references that helped us to make this presentation so nicely. Thank you for your patience listening. And now I am handing over to
Yeah,
Shomendu sir.
okay. Okay.
Thank you.
Thank you, Priyanka. You have summarized it very well, and thank you all the speakers, Pritha, Devoshmita, Pritha. Yes, Shomana ma'am has written all are very good. Shomana ma'am, if you have anything to share, so Pritha, Priyanka, Ritu, and Rajashree, everybody done a very good job. I think screen we can stop share the
Stop
screen,
sharing.
and we can have you on the screen, everybody, and we are open for question and answer. But what I understood from the situation or the rheumatoid arthritis is not only the joint pain, or it is not the disease of joint only, it affects many organs, especially the nerves. So
Yes.
one thing is very important. Sometimes patient complain about eyes, that is rheumatoid patient often complain about dry eyes, that is cornea, and glaucoma is also very common to these patients. And patients are on steroid or hydrochloroquine. In those patients are on medications, mainly these patients complains about the retinal problem. So one thing we need to say, we have already discussed in the session, that patient should go for a retina checkup every year, those who are on rheumatoid arthritis. Small things should not be neglected. And what is said by Rajashree is very well, that is the intervention of the therapist. So it will be a holistic treatment approach for the patients, especially the patient's caregivers or the patient's family members should be well educated of this disease. So as an educator or a clinical nutritionist, you can play a very major role. So one thing that can be said, that medicines have a lot of side effects for rheumatoid arthritis. So what Ritu has discussed, if you go for this dietary management, just not only आपको बैलेंस डाइट देके छोड़ देना है, ऐसा नहीं है. ये जो छोटा छोटा चीज रितु ने एम्फेसिस किया, we all know this. Anti-inflammatory of turmeric and piperine, that is black pepper. We know about handfuls of nuts and its healthy benefit. But little bit thing you have to include, that nuts जो भी लेना है आपको भिगो के लेना है. You have to soak the nuts and then consume it. So many people do not take nuts on a regular basis. They rarely consume nuts. So these are the things, if you can just give idea to the patient, your patients will be highly benefited. And during our first discussions also, we have, even we in our chat box also, we are there, that is the patient should go for a cardiac checkup also. Those who are on rheumatoid arthritis, sometimes the steroids are not suited, and the medication which is called methotrexate, Rajeshi, if you are there, you can highlight once again, it reduces the folic acid level in the body. That's why folic acid
Yes, sir.
supplementation is required. Rajeshi, can you once again highlight why folic acid is required for this patient? You are on mute. Yes.
Yes, sir. Folic acid is needed for the patient with methotrexate, as it plays a very important role in dietary modification. And the other part of folic acid in methotrexate is very why important is nicely discussed by Ritu in dietary management part. So well well explained by Ritu. So Ritu, can you take?
Yes, Ritu, can you add something?
Yes,
Why folic
as
acid
a
is required?
side effect, there is some side effects. Always we know that there is always side effects of some um, uh, medicines. So, as a side effect, these methotrexate helps in the uptake of the absorption of the folic acid in our blood. So, when it has the interference of the absorption of in our blood, folic acid, the level of the folic acid reduces. That's why we need to we need to incorporate folic acid from the outside through the
From
diet.
outside food source, or in the form of medications, in the form of supplements. Not only through diet people will be able to maintain. So at least I think weekly twice it is being prescribed folic acids. So that is very very important, folic acid. So when you are getting a prescription of rheumatoid arthritis by a rheumatologist, so Pritha, we need to check the composition of each and every medication. We need
Yes.
to understand what is the function of this medication. We need to understand what is the disadvantage of this medication, and that is what explained by Rajashree and Ritu. That is the supplementation. So even I am wondering that 2 or 3 days back I was asking Pritha, just check why folic acid is given. So the thing is, because of this methotrexate drug, the drug name is a generic name, or the company name, sometimes it is coming in the name of Folitrex. So Folitrex, when it is given, so why the name is given Folitrex, that we need to understand. The generic name or the chemical name is methotrexate, but the company name is given Folitrex because some relation is with folic acid. That's why Folitrex. So what Folitrex is doing? Folitrex is actually hindering the folic acid absorption, or it is lowering the folic acid level in the body. That's why folic acid supplementation is important.
Is required, and diet can be a very good option for that by protecting the thing. Like
Yes,
if we give
anemia is
the
commonly
folic
you
acid,
people have said. Anemia
yes,
is also common.
anemia is also
Anemia is also
Yes, so
occurred at that time.
due to folic acid deficiency.
anything, Priyanka, do you want to highlight? Already you have given a good presentation. So,
Thank you, sir.
so if you want
I
to add,
someone asked here that
okay, let me ask the question answer.
Okay.
can you give the synthetic vitamin C supplementation? I think if it's better to meet the vitamin C requirement through the diet mostly.
Through the
That is the
diet, if
basic.
it is maintained, it is not required. But sometimes, if there is a deficiency, vitamin C 500 mg, and always we prescribe this vitamin C 500 mg in the form of saline tablet, Lim C. So it will not harm. It will be good for the patient. You can give to the patient. So, but what Priyanka, I admit with you that we can give lemon, we can give mosambi at least after food. So iron can be just absorbed, and reducing the saturated fat, we can at least give the that is saturated and trans fat we can limit, and we can give the good fats, omega-3 fat
Good
in
fats,
abundance.
healthy fats.
Yes, sir.
And as this disease is prevalence to women, so that's why we have to check more on the other comorbidities as well, other comorbidities, other complications, that why the woman is suffering. So that why we have to support. Like diabetes, it is a silent killer. Rheumatoid also, like type 1 diabetes, it is also an autoimmune disease. So you have to support in many way. And many very good things suggested by Priyanka is the exercise, different hand grip strength, different strengthening exercise, little bit of weight lifting, help of the physiotherapist. Cold and hot compression is very much required. So you can dip your feet in the lukewarm water, hot water, with giving some mineral salts into it. Giving a mineral salt, you can dip your legs, dip your feet, and then give the ice back. So hot and cold combination can be beneficial. But obviously, it cannot be treated. Already you have discussed in your presentation, it cannot be treated with medications. Lifestyle modification is very, very important.
Very much important. And also, I would like to highlight that the rheumatoid arthritis is one of the major factors that gives rise to various other comorbidities like CVD, diabetes, and obesity. So we have to take care of that by medical management.
CVD, CVD, yes, very good.
So any other questions can ask?
Niacin is asked in the chat box by Jyoti. Yes, niacin is used in the treatment of osteoarthritis even, and also rheumatoid arthritis. So it is good for the joint pain. So this is very, very much suggested sometimes, but the doctors also to improve the arthritis symptoms. So including some, it is actually acting as a non-steroidal anti-inflammatory drug. So it can be sometimes given. Niacin, uric acid में भी शायद दिया जाता है. You can already check it.
So there is one question that is swimming helps in to control the rheumatoid arthritis. So I would like to say here that as the disease is a progressive one, it starts from the early stages and leads to the chronic one, that is the irreversible or untreatable. So first of all, the as Priyanka has highlighted in her part, that minimal exercise like strength to increase the muscle strength or the hand grip strength, this can be done, or physiotherapy, as Rajashree have mentioned in her part, this can be done as a prevention to control rheumatoid arthritis. I guess the other speakers will also agree. If you can say something, Rajashree or Priyanka.
About exercise.
Swimming has the ability to reduce the weight also. When
Yes.
the weight is
Yes,
also reduced,
very
then the
Yes.
joint pain also reduced. It will also reduce. So that by this swimming also helpful.
I agree with Ritu. Ritu, first thing we need to check that we need to bring the patient into ideal weight with the
Yes.
calorie restrictions or with the dietary modification. If the patient is overweight, then it will be an overburden for the patient. And micronutrient is very important. We are coming to Dahlia and swimming. The patient in the initial stage can do swimming.
Initial stage can do,
The
but in the
patient
latter
The
stage, as
latter
the
stage it can't be
bones
done.
get fused with one another, the bodily movement is totally prohibited.
and it is
So
not that Pritha, that it is age restricted. बहुत young age patient को भी होता है. मैंने
yes,
देखा है rheumatoid clinic में 17 18 years 19 years girls, and girls are mostly affected, and it is
yes.
some to some extent genetic also that we have discussed.
Yes, or Orunima Kaur have written that use rheumatoid arthritis hereditary, obviously, because it is caused by the defects of the gene HLA-DRB1, which I have already come across. That is the human leukocyte gene. So the defects of the gene can be a factor that can lead to this disease.
So one thing I can understand, that as you people are all in the student level and somebody has started recently practicing, but awesome job you have done. So that's why this is the beauty of cognized nutrition, that when something is given to you as a task, you people just passionately do, and you have showed your passion today. So when Pritha started, I was just, it was so eye-soothing to hear from Pritha, and one by one Rajashree, then Ritu, then Priyanka. So I was if I close my eyes, I was listening to some good national webinar. Like I was listening to some expert in the webinar. So this is the thing that this motivates the entire cognized nutrition students or the nutritionist or the upcoming nutritionist, that everybody can do everything. আমাদের জন্য কোনোটাই ইম্পসিবল বলে কোনো ওয়ার্ড নেই। আমরা চাইলে আজকে যে অনেকগুলো ইনফরমেশন তোমাদের থেকে পেলাম, সো আমি অনেক কিছু জানি না, অনেক সিনিয়ররা আছেন তারা বলতে পারবেন, বাট আমি অনেক কিছু শিখলাম। আই লার্ন মেনি থিং ফ্রম ইউ, অ্যান্ড ইট ইজ এ ভেরি ইম্পর্টেন্ট টপিক। সো মোর ইউ এক্সপ্লোর, because in our time it was there is no provision of internet, only we have books to read, and even to order books we do not have Google or smartphone in my internship days. So at least we should not waste our time. We give many excuses, and बहुत डिले हुआ है, ये rheumatoid arthritis का भी बहुत डिले हुआ है, बाकी प्रेजेंटेशन बहुत डिले हुआ होते होते आज हो गया. So that is a very good, मगर at least I can say you can do anything in the world from this today's discussion. I can understand.
Thank you so
Thank
much.
you, sir.
Thank you, sir.
You have given.
Okay, sir, I have another. Okay, yeah.
Ma'am is there. Ma'am,
Yeah.
ma'am. Nina ma'am, you want to ask anything? We are really privileged to have Nina Singh ma'am, who is a very senior dietitian.
Yes, ma'am, please.
And eminent faculty from our organization. Ma'am, you
whatever I heard, I joined in later, but was there any mention of glandular meat? Glandular organs and meat in your
yes,
thing
which
regarding
they
the
have
diet?
mentioned. Ma'am, I will share you the entire recording, but Pritha, just 1 second, just share your screen and show your slides to ma'am, and just ma'am can see what you have prepared. But as a student level, they have incorporated many things.
Yes, I came in the last bit, which I found was very good and interesting. But
But
about the diet
was more
guidelines,
interesting. So
I
that's
just
why
want
I am
to-
requesting Pritha to share. Pritha, is it possible or should I share?
Sir, I have already shared, sir.
Okay, okay. So one by one, go slowly so that ma'am can see. After that, I will take Dalia's question.
Sir, it is visible.
Not yet the slide. Yes, go to the first slide. Very slowly move one by one so that, and you just tell one line that what you have kept in the slide.
Uh, yes.
And ma'am can add her inputs also. Some where she is
Yes.
very experienced.
Yes, yes, ma'am. So here, ma'am, we have given a brief introduction of what is an autoimmune diseases and some of the organs that are associated with our immune system, and also the factors that.
you can just go to the diet part if you.
One
Okay,
by
okay.
one, just move. No need to explain. Just move one by one. Yes. This is the prevalence. Go. This is the definition. Go. Incidence, risk factors, stages, clinical manifestation. Good. Diagnosis is one thing I have asked them to include. They have not included that. Yes, go. This is a good slide, ma'am. RA and comorbidities associated. Yes, management. This is the medicines and doses and its side effects and its effect. Bit surgical management. Now, yes, slowly, just let ma'am interfere into this. Yeah, ma'am.
A balanced diet and anti-inflammatory omega-3 fatty acids, adequate calcium and vitamin D. Okay, and what to be avoided?
Flavonoids and carotenoids. Okay, go next.
Foods to be included. Fine.
And folic acid, ma'am, they have mentioned in the last slide.
Yes.
There is a
Yes.
deficiency in the folic
Yeah.
acid.
Generally because of the absorption.
Curcumin and piperine for the anti-inflammatory properties. And go to the next slide. Preferences and study.
Yes, low-fat meat, a low-fat diet it would be included then. The saturated fats, yes. So it would come in under that to avoid organ meats and all.
Okay, ma'am.
Yeah?
Low fat
Okay.
means they can at least mention low saturated fat. Fat
Yes.
should not be low. Good fat can be included in the form
Right.
of omega-3.
Right. Fine. Thank you.
Anything more, ma'am, they can do in the dietary part because they are all nutritionists. We are not doctors.
No, because they just, broadly said, saturated, trans fats and all that. So maybe they can give examples of that because, everybody will be clearer. That's all.
Yes. What are the saturated fats and what are the omega-3 in what forms? Especially now, students, you can do one thing. You can
Omega-3 seeds and all that, nuts, flax seeds.
Nuts. And next time,
Fish.
what we will do only on diet, we will do Pritha. At that time, we will give the explanation of each and every seeds, what amount we can take, and
fish is a very good source. So basically, to highlight a bit on the sources of the fats.
So yes, ma'am. Next time we will elaborate on this part. This is flaxseed, fishes, the dairy, mushrooms.
Yeah,
and
that would be nice.
Yes, ma'am. And here we have given a brief idea of some of the foods that need to be avoided, like the white sugar or flour, as you have mentioned, ma'am. The meats, the fried oily foods, saturated and trans fats. Okay, ma'am. We will describe is a.
Where you've written red meat, you can add that.
Okay, ma'am.
You add red meat, and why you have considered gluten, avoidance of gluten, that also you can elaborate bit with a diagrammatic representations of gluten containing foods, why you are restricting, because as it is inflammatory, and obviously the sugary drinks you have mentioned.
Right. Okay. Very nice. Good.
Okay. Thank you, ma'am.
Okay. Thank you.
Ma'am, it's privilege you have joined. It motivates the students.
Thank you.
Oh, yeah.
Right. Very good. Keep it up. Very nice.
Okay, ma'am. Every month we are trying to do 2 new topics by the students. So
yeah, that's interesting. Yeah.
we are coming with childhood obesity and another topic that is South Indian cuisine in controlling diabetes and cardiovascular disease. So
Okay.
we have some people from South India also, so they will
Yeah.
join.
That's good.
Okay, okay. Thank you, ma'am. Any more questions? Yes, many people have raised hand. Arpita Sharkar.
হ্যাঁ স্যার, গুড ইভিনিং এভরিওয়ান। আর সবাইকে অনেক কংগ্রাচুলেশনস। সবাই এত ভালো করে মানে এক্সপ্লেন করেছে, দারুণ দারুণ হয়েছে একদম। গো অ্যাহেড,
Thank
খুব
you.
ভালো লেগেছে। আর এটা আমার দরকার ছিল স্যার, আগের ওপিডিতে আমার খুব প্রবলেম হয়েছে, এটা আমি লেটে পেয়েছি। আমার আগের ওপিডিতে পেলে আমি খুব ভালো ছিল, কারণ তখন এতটা আমার মানে ধারণা ছিল না যে কি কি এক্স্যাক্টলি করতে হবে। কিছু কিছু মিলেছে, কিন্তু কিছু কিছু তো বুঝতে পারিনি, তো ওইভাবে করে দিয়েছি আর কি। তো এটা হলো পরবর্তী কালে আমি আরো অ্যাপ্লাই করতে পারবো, এগুলো অনেক ইনফরমেশন পেলাম। আর একটা যেটা আমার মানে যে জানার আছে, যে এখানে কি প্রোটিন মেটাবলিজমে কোনো হ্যাম্পার হয়, মানে প্রোটিন রেস্ট্রিকশনের কোনো কি ব্যাপার এখানে থাকতে পারে রিমাটেড আর্থ্রাইটিসের ক্ষেত্রে?
না, ঋতু কিছু বলো, তারপরে আই উইল অ্যাড।
রিউমাটয়েড অ্যাজ আ সাইড এফেক্ট অফ রিউমাটয়েড আর্থারাইটিস, যখন যদি কিডনি এফেক্ট করে বা যেরকম কার্ডিওভাস্কুলার এফেক্ট করছে, তখন প্রোটিন মেটাবলিজমের, প্রোটিন রেস্ট্রিকশনস এর কোনো ব্যাপার আসবে, কিন্তু তার আগে নয়। যেহেতু এটা ইনফ্লামেটরি মার্কার্স, আমাদের অ্যাডিকুয়েট অ্যামাউন্টেই প্রোটিন দিতে হবে, যেটা which is 1 গ্রাম per কেজি বডি ওয়েট।
আচ্ছা, ওটা খুব সিভিয়ার কন্ডিশন ছিল আমার কাছে, যিনি এসেছিল মানে ওনার নি রিপ্লেসমেন্ট করতে হবে এরপরে, মানে এরকম একটা স্টেজে উনি আছেন আর কি। আর এমনি কোনো ওরকম ব্যাপার ছিল না যে কিডনি এফেক্টেড বা
Knee replacement is not because of rheumatoid arthritis.
মানে
Joint maybe when it is combined, उनको osteoarthritis भी है।
হ্যাঁ, ওর সাথে কম্বাইন্ড ছিল মেবি, তো ওই জন্য আর কি জিজ্ঞাসা করতে। কিন্তু অন্য আদার্স কোনো কমপ্লিকেশন ছিল না, লাইক কিডনি ডিজিজ বা আদার কার্ডিওভাস্কুলার ডিজিজ, এরকম কিছু ছিল না। ওনার রিমাটিড আর্থ্রাইটিসই ছিল, ওটাই সিভিয়ারলি ছিল। তো ওটার সঙ্গে আমার ওটাই জানা ছিল যে প্রোটিন কোনো ক্ষেত্রে তো উত্তরটা তো পেলামই।
তো আমরা দেখে নেব, we can ask Bijoy ma'am also, Bijoy Das ma'am. So is there anything linked so that we can answer you properly? But as I
এখানে একটা কোলাজেন আর ভাইমেটিনস এর একটা তো ব্যাপার আছে, কোলাজেনটা কনভার্টেড টু আর্জিনিন ওই যেখানটা হচ্ছে আর কি, তো ওই ক্ষেত্রে কি ওই ওরকম ভাবে কি কিছু রিলেটেড আছে, এই জন্য আর কি জিজ্ঞাসা করছি।
না, এখানে তো আমাদের সাজেস্টেড গাইডলাইন is plenty of high protein, good quality protein, daily exercise and muscle strengthening. And one article I found, that is people usually what they do now after 40 to 60, people do less amount of exercise. They do not go to gym. What they do, they are especially on 40 हो गया या हमको ना heavy exercise नहीं करना है, थोड़ा walking कर लिया, थोड़ा स्विमिंग कर लिया, बस एरोबिक्स, कोई स्ट्रेंथनिंग नहीं करता। मगर सजेस्टेड आर्टिकल इज सेइंग दैट मसल लूज हो जाता है ना इस टाइम में, सो और ज्यादा आपको फोकस करना होगा, गोइंग टू जिम, डूइंग सम स्ट्रेंथनिंग एक्सरसाइज, स्ट्रेचिंग, लिटिल बिट ऑफ वेट लिफ्टिंग, दीज आर सजेस्टेड, आई फाउंड इन आर्टिकल, in a news article. So that's why what Ritu said, that is protein is in good quality, we require protein. Restriction, we have to check it. Okay, so no more question. Dalia, just last question. Acha, what Shudipta di has said in the chat box, we can reduce gluten protein. Acha, gluten protein can be reduced, that is the thing, it is reduced inflammation. Acha, about exercise is true because my mother is suffering. Yes, exercise really, Shudipta di, the same, I agree with you. Dalia?
Yes, sir. They have a commendable job. It is excellent session. My question is, sir, my mother-in-law has this rheumatoid arthritis, and when her pain increases, I always seen that there is a high uric acid level. So, is there any relation between hyperuricemia and arthritis? This I want to know.
Yes, uric acid does not cause osteoarthritis.
That's true, sir.
But uric acid, as you know, it actually advanced stage is gout. So it is suggested, one more test, Pritha, we usually suggested, for my mother also it is suggested to check for the serum uric acid level. So uric
Yes,
acid,
sir.
you know the crystal formations in the joint. So that's why somehow to it is related, but not directly related. Yes, we should consider uric acid, and you should
Means
avoid
it can trigger the disease.
trigger the disease. Yes, the term rightly said by Pritha, and we can limit the high purine food, but it is not recommended to avoid every seeds and all these veg proteins. There is no relevance in uric acid now, but at least we can considering the high protein and high purine in that aspects. Maybe Orpita will be correct, will be right. Otherwise, there is no direct relation.
Okay, sir. Okay. Thank you, sir.
But yeah, these small things you have highlighted now, this is a very important. You need to check for the rheumatoid
Uric
arthritis
acid
में
also.
आपको side by side serum calcium, uric acid, and side by side आपको vitamin D, very 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 important. Vitamin D बहुत
Okay,
कम
sir.
पाया जाता है. When my mother is diagnosed, it was very low vitamin D, but
Yes,
after
yes, sir.
supplement now the vitamin D level is okay. So क्या है ना, vitamin D at least support, it will give support in the calcium absorption. So other thing trigger नहीं करेगा ना, ये आपको देखना होगा. Yes, thank you.
Now I'm finding most of the people, especially ladies, they're having this vitamin D deficiency.
Yes, ma'am. Even
So-
after COVID, na ma'am, there is
Yes.
too much. People are
Right.
sitting inside the home and severe deficiency, ma'am. It is 5 or 6.
Yeah,
They are
every second person is, having this.
Yes,
deficiency.
ma'am. So I
It's
think
really sad.
in our routine checkup, we should go for a vitamin D checkup, and we
Right.
can just record, because vitamin D with the diet it will not be enough. So we
Exactly.
have to take
Yeah.
the
We have to take
supplements.
supplements.
60 KIU, that is weekly as per
Yeah.
the doctor's advice.
Right.
So that is the thing. Okay, so we can wind up the session for today, and we have really good explanations, and session is very good. So if we have no more questions, we can wind up for today. Thank you.
Thank you. Thank you everyone for your patient listening, and thank you, sir, for giving all of us this platform. We are seriously very much enriched with this. Thank you so much.
Thank you.
Thank you.
Thank you, sir.
Thank you.